So now daratumumab moved to first line, and so it is a real change because in the last few years daratumumab was used in second line, was studied in many retrospective and also prospective studies as a second or third line option. Now daratumumab is the backbone on first line regimen as for stage 1 to 3A patients, and its role will be also need to be evaluated for the use of maintenance, because as we know the ANDROMEDA trial was in the ANDROMEDA trial it was proposed a 24 months maintenance of daratumumab, and we are still waiting the final data about overall survival from the ANDROMEDA trial, and we will need to see if the use in the real world of this approach of 6 months of daraCyBorD and maintenance with 24 months maintenance is the best option, or we have to change our approach and reduce the time for maintenance maybe up to 1 year, or we have to increase the maintenance in some patients. In that, the role of daratumumab also probably will change the role of autologous stem cell transplant, because it's another open question: what is the role of autologous stem cell transplant in the setting of patients that are receiving daraCyBorD and are having a profound hematologic response and organ responses.